Good evening, everyone. I'm Mayor Steinberg, your mayor, and I want to welcome you again tonight to a mini town hall, if you will. I want to thank the Sacramento Bee. They are working in partnership, in a sense, with my office through their Facebook page to make sure that I get to answer your questions, and there is a broader audience reach between my own Facebook and social media outlets and the Bee. I hope that that many of you are watching at least some of this. Let me begin by updating you on where we stand in the coronavirus COVID-19 battle here in Sacramento County. Our goal, of course, is to save lives, to make sure that fewer people get sick, and to do everything we can to mitigate, if not prevent, this hospital surge that we know is happening throughout many parts of the country, and we anticipate to hit California very, very soon. In Sacramento County, we're now reporting 314 cases of COVID-19. That's a 40% increase from Monday, which is a lot, but compared again to other parts of the state and other parts of the country who are seeing an actual doubling every 2 to 3 days, our pace is still relatively good compared to other parts of California and other parts of the country. 9 people have tragically died. Again, too many people, but fewer numbers than in other parts of the country. So here's one that really bothered me today. The Sacramento County Department of Health reported to me that about a third of the coronavirus infections in Sacramento County come from churches. Now, that is not to broad brush the faith community. In fact, just the opposite. The faith community has done an incredible job, not only helping people through this difficult time, but also by going to do their services, whether they be Friday nights, Saturdays, or Sundays, virtually. And as a result, a lot of people are still able to participate, but there are some churches in the county that account for 1/3 of the outbreak. So if you are the leader of any faith community and you are still holding prayer circles or still congregating, stop now, because this is an area where obviously we collectively can make our good numbers even better together. It is crucial, as we've said repeatedly over the last couple of weeks, that we limit our physical distancing in every way. We've almost all become students, master's students, PhDs in what it takes to flatten the curve in the United States and in California and in Sacramento. And we know that in the absence of broad-based testing, which is not coming soon, even though there are more testing opportunities now, before there is a vaccine or some kind of immunity, the only way we are going to get back to some degree of normal life, and more importantly, to reduce the number of people that get sick, is to practice physical distancing. It doesn't have to be social distancing, because we're finding ways all the time to connect with one another. But 6 feet apart, limiting the amount of time that people go out. It is okay to go outside and take a walk, but even when you do so, to make sure that you are distant from anybody who is doing the same thing. This physical distancing gives us a chance to avoid the astronomical escalation of illness and death that we're seeing in other parts of the country and in other parts of the world. I know it is not natural, and it doesn't always feel good, but we must do it. And Sacramento, again, is doing relatively well. And California is doing relatively well, in part because we started our physical distancing before other parts of the country. We all know about New York State, and God bless them, and the governor and the mayor and all they are doing, and especially the healthcare workers and the first responders, just like here. They're doing an incredible job. But the fact of the matter is that we started our physical distancing order in Sacramento and in California days before they did. And when we started, 204 people had died in California. When New York started, they were already at 1,000. So you can see that if we just continue this, God, we have a much better chance for the outcome that we all want. We don't know whether or not, in the end, we're going to be able to avoid the big surge in Sacramento, but we have a chance, and it will be better, so let's stay with this together. Enough preaching, although I think it is the most important message that any political leader now can continue to emphasize. But I want to go and talk about a few other things before I take your questions. I want to talk about mental health for a moment, because you all probably know, at least those of you know who followed my life and my career, that this has been a passion of mine for a long time. I have always felt that mental health is the unaddressed issue of our time, and that we all know somebody. Everybody knows somebody. It's in all of our families, and we just don't talk about it as much as we should. Homelessness may be the most visible manifestation of untreated mental illness, but the truth is that mental health and mental illness is about all of us. And now, in the midst of the coronavirus, people are feeling even more anxious, and people are feeling depressed. And I've said this before, and I want to repeat it. If you are feeling anxious, if you are wondering what the meaning of life is or what the purpose of your own life is, if you're feeling depressed, if you're wondering whether this is going to end, you are normal, because the majority of people, including me, your mayor, are experiencing a lot of the same feelings. And so there's help out there. I want to give you a number for a warm hotline that's funded by the state of California. The number is 855-845-7415. That's 855-845-7415. You can talk to somebody and at least for a few minutes or maybe an hour, talk out your feelings. And if you need more help, they can refer you to more help. Through my institute, the Steinberg Institute, we are working to try to fund and set up other similar services in California and in Sacramento so that people have ready access to be able to talk to somebody. Because if you're not feeling a little bit anxious, if you're not feeling a little bit down at times through this, you probably aren't taking this as seriously as everyone else is. So those feelings of anxiety and depression, man, go easy on yourself. Hang in there. You know, one of the things that heartens me are the remarkable acts of kindness and charity and philanthropy that are happening all throughout California and through Sacramento. Our Donate for Sacramento fund has raised nearly $700,000 in a week. And a most recent donation of $20,000 coming from AT&T. Ford Motor Company gave $100,000 to donate for Sacramento. And now it's sending thousands of plastic face shields to our hospital workers. We've told the story a couple of times about restaurants that have had to close their businesses are now keeping some of their workers employed. We've gotten about $175,000 worth of city resources to them to be able to deliver meal kits to over 700 seniors in our apartment complexes. There's so many stories. Hacker Lab, what they're doing to manufacture face shields. Tomorrow I'm going to be highlighting the work that Solomon's Delicatessen is doing. Every day I'm going to try to highlight another act of simple heroism around the that being done by the people of Sacramento in real time. So now let's get to your questions. Some of these were submitted to Facebook earlier today, but others are questions that the Bee has commonly received from readers in recent days, compiled by Assistant Managing Editor Ryan Lillis. Thank you, Ryan. So one question that everybody asks about, and boy, this was not when the coronavirus crisis started. This has been during my entire tenure, and that is about the homeless. And Frank submitted a question on the Bee's Facebook page earlier today about how the homeless can find bathroom facilities in downtown Sacramento with so many buildings closed. So I want to use your question to talk a little bit more broadly about homelessness. This is an issue, I've said during my tenure as mayor, I probably spend 50% of my time on this issue. And during the coronavirus, probably maintaining the same the same amount of time because I'm most worried about this. First of all, it's unhealthy absent the coronavirus for people to be living unsheltered and on the streets. And this only makes it worse because if there's going to be a more widespread of the virus, it could come from the homeless population where people are already medically fragile, where there are a lot of elderly people, and of course hygiene is a real challenge. And so we are working with the county, and Sacramento steps forward. The best we've ever worked with them before. You know, over my couple of years, there's been different tensions or different jurisdictions. We've overcome all of it. We are working really tightly. And everything takes too long. But over the next days, together, we are going to announce a plan that I think is going to please the people of Sacramento. More importantly, it is going to address the problem in numbers that we've never had the opportunity to address before. We need to get people into shelter. More importantly, we need to get people who are either symptomatic or tested positive, or people who are at risk into single room hotels and motels as quickly as possible from the streets and from our existing shelter system. In addition, we have got to more aggressively bring hygiene out to the encampments, and including bathrooms. And that's going to happen. Our public parks are still open. Most of the bathrooms are still open. But in the next days, I am hopeful that we're going to announce a plan with the county that is going to meet the moment, as Governor Newsom has said, and meet the need, and in an opportune way, maybe, do what we have not been able to do to the volume that is required to actually get people off the street, not just during the coronavirus, but for a much longer time than just that. Let me move on. Another reader asked what I know about Sleep Train being turned into a temporary hospital. We've received lots of questions about this in my office too. So it is no secret that the federal government, the state of California, is working with local government and private business to locate as many additional potential hospital beds to deal with the expected surge. And it's not just the Sacramento surge, it could be the Northern California surge, because we're Sacramentans, but we're also Californians, and we are in this together. And so yes, the U.S. Army Corps of Engineers, the state of California, is in fact working with the Kings and with the city to look at Sleep Train as a possible site for those beds. But nothing is final yet. And I know people have a lot of questions about this, understandably. I think the vast majority of people are going to be supportive of this because it's the right thing to do. And we will let the public know as soon as we know that a contract is actually near finalized and they're ready to go. Now, in the end, even if we set up Sleep Train, will the beds be needed? We don't know. But the reason, again, that California has a better chance here is because we're now weeks ahead, and we can plan for mid-April, the end of April, mid-May. I listened to Dr. Galley today, the Health and Human Services Secretary for the state, a good friend of mine, by the way, who I've worked very closely with on homelessness and mental health issues. And he showed the curve that shows that, it's mid-May when the big surge could hit. So we have got some time, and we have to use that time in Sacramento and in California to make sure that we have all the beds, all the equipment, of course, that is necessary to deal with whatever comes our way. So, next question. Some people have asked, while other jurisdictions have closed parks, why isn't Sacramento closing parks? Well, a couple of reasons. Number one, aside from a few of the exceptions that I talked about earlier, a couple of faith congregations that are causing a problem, Most people are complying with the physical distancing requirements, even in parks. And parks are one of the few places now where people can get out and actually have an outlet and get some fresh air. So we have made a decision on balance to not shut the parks. And if we start seeing widespread violations, if you will, in the parks, or people having picnics or that sort of thing, we're going to come down on that, as we have to. But right now, on balance, we think it's important to give people that outlet. We do have signs at most of the parks that discourage kids from playing on the equipment, which is really a tough thing to do. But the reason is because we are not confident that we can sanitize that equipment after every use. And we, again, want to do everything we can to reduce the spread. All right, another reader points out that Sacramento has had the highest number of coronavirus cases in the county, more than half of the total. They wonder if we're doing a good enough job here of following physical distancing measures. Again, proportionately to other places in the country and even the state, we're doing pretty well as a county and as a city. And I don't know myself what the actual difference is between the city and county. I do think that we're a little more dense here in the city than in the suburban areas. And of course, one of the reasons why there has been such a huge outbreak in New York and in San Francisco is because people live closer together. And I think that's more true within the city. But again, there aren't huge differences between our city and our county. The key is, as a city and a county, we are in this together, and we are all practicing the same physical distancing. Another question: how long do we expect the stay-at-home order to remain in place? So the Bay Area just formally extended their stay-at-home order until May the 7th. Dr. Bielenson has not yet amended the order, but I am very confident and clear, not happy about this, but it's the right thing to do, that the County of Sacramento will extend its stay-at-home order. And the state, of course, which would override the county, the stay-at-home order will be at least through April everywhere. And probably a little bit longer as we adjust to this new world. But when you think about the scope of time and the fact that we have so much to look forward to when we have flattened the curve and can get back to life, I know that we can get through the next 4 or 5, even 6 weeks, adjusting as the way we are adjusting. A few other questions that I'm getting asked. People ask about construction because, again, the Bay Area issued an order that shut down construction. We're not doing that in Sacramento, at least yet, and I hope that we don't have to. I've talked to the construction trades people, and they are practicing physical distancing at the work site. And I'm going to go take a look at some of that myself tomorrow in a safe way. The workers, for example, around the convention center project are staying appropriately physically distant. They're not eating lunch together. There are no food trucks. And I think, on balance, if we can continue to maintain construction to keep people working and to make sure we've got some economic activity going, especially around housing and affordable housing, but really across the board, that's the right balance. But we've got to do it right in order to keep it going. How can you help? God, there are so many ways that people can help. We talked about the Hands on Sacramento website where you can volunteer to deliver food. The food bank needs volunteers. I think over the next couple of days, we're going to really be deliberate in listing out all the different places where you can help. I know Governor Newsom announced a big senior connection project, so we're going to get all that information and inform you as quickly as possible how you can volunteer to get on the phone and call 2 or 3 seniors a night here in Sacramento. I think we could reach every senior here because we have enough people who are willing and happy to be of help here. Finally, today is Census Day. It is April Fool's Day, but I don't think anybody's fooling anybody today. Although I might end with a joke. I don't know. We'll see. Maybe that'll be another part of the new tradition here. Today is April Fool's Day, but it's also Census Day in California and in the United States. What is the census? It is the count that we do every 10 years in this country that decides several things. Number one, how many congressional representatives do we have in Washington? As important, how much money does Sacramento and California get when it comes to the trillions of dollars of federal assistance? And so here's a real life example of why this is important. In the federal stimulus bill that just passed less than a week ago and signed by the president, there's a provision that says that cities with a population over $500,000 get direct aid. And so the 2010 census, we were under 500,000. But because of the great growth in Sacramento, and I think growth in the right way is a good thing. It means more jobs, more housing, and more vitality. That we are now at 508,000 according to the 2018 census numbers. And so we don't yet know which numbers they're going to be using, and this is something that we're working very hard on, believe me, because there's tens of millions of dollars at stake. But if we do prevail, and they use the 508,000 number, it will only be because we took the census seriously and we counted all Sacramentans. And the difference between 495,000 and 508,000 is going to maybe a huge difference in terms of the kinds of aid and benefit and economic development resources from the federal government we can provide to our people. So do the census. I am not a good technology guy, but I was able to fill out the census online while I was on a Zoom call. I didn't mess up the technology once, and I finished it in about 5 minutes. Okay, I do have one more question. Sorry that I said I would do. Just got a few more minutes? Okay. What about the arts? Now, this might not seem like an essential life activity, and so why would I raise the arts in the midst of this when we have a huge health crisis? The arts may not be life and death, but I want to tell you they are part of the lifeblood of our community in Sacramento. It's what brings people alive. It's what creates beauty and magic and music and painting and theater and ballet and all the new and young artists. And we have an incredible art scene in Sacramento, and the arts are hurting big time. And so we're thinking through, especially if we qualify for this federal stimulus, how we can make sure we don't lose the momentum that we have created in Sacramento to make us the capital of the creative economy here in California. So a couple of short-term suggestions. Go to the Donate for Sacramento website and donate to the arts. Go to the Region Foundation website and donate to the arts. And if you are a patron, a season ticket holder of any of our canceled productions, consider donating charitably back to the theater, the symphony, or the ballet, or whatever your passion is. Donate back the ticket price to them so that they can continue to survive, not thrive, but survive, even if the performances are temporarily halted. Okay, a joke. I am known for corny jokes, and I promise you if I start telling jokes, they will all be clean. So here's my joke of the day. My nephew told this to me, and I thought it was pretty funny. And you're going to have to really listen hard and get it, okay? Here it is. There are two kinds of people in life. Those who need closure. That's the end of the joke. Think about it. Good night, everybody. Be safe. Stay home. And we're going to get through this together. Thank you.